Welcome back to Dr. Christian Schubert's channel. My name is Wenzhi. I'm a patient of Dr. Schubert. Today we are going to make a video in English about periodontitis. So if one person doesn't take care of his oral hygiene at home and he doesn't go to his dentist regularly, eventually he is very likely to develop periodontitis. I'm not making this up because we have already shown you the very cruel statistical data. Now that if a person has periodontitis already, what kind of treatment options are there in Germany? Which ones do you prefer?
Well, the treatment options are definitely from extracting the teeth, preventing them by anti-inflammatory therapy like deep scaling. That means you go deeper with cleaning your teeth in comparison to the professional teeth cleaning, or you go back and only do the professional tooth cleaning or implant cleaning. These are the three main structures you have. And it only depends on the degree on periodontitis and the pocket depth you really have.
And over social medias, I have seen quite a few people, when they were diagnosed, they already had pocket depths from 5mm to 8mm, and they would have to receive flap surgery. It's very popular in China because a lot of patients are diagnosed late and most clinics can't afford the Photona laser devices.
Well, we should do everything to prevent actually the flap surgery. Actually, there is always at least one session on prophylaxis before we start the process on anti-inflammatory therapy. That means you get in anesthetics and you get the deeper cleaning, so the deep scaling, as we say, and then you have to wait another 6 to 8 weeks, and you get an appointment for controlling and maybe an X-ray, and then it's going to be decided on whether the treatment has done an improvement or it's gone even worse. That might happen, rarely, but it might. And when you then, afterwards, you even have pocket depths more than 5.5mm in Germany, you can go on with kind of flap surgery. But flap surgery always means that you have a severe treatment on your teeth, another deeper anesthetics session, and the surgery is gonna mean that there is quite some pain, stitches being made, and there's gonna be a resulting process on even more on bone loss all around your teeth. So it is quite a little bit hard to understand, We are talking about these deep pockets between tooth and gum. And the main thing is to improve the pockets and to get smaller pockets. And this all comes by an inflammation that goes from the gum to the alveolar bone all around your teeth. And when you open this area by flap surgery, that means that you even gonna have a more deficit on bone loss all around your teeth. And the result is only gonna be that you take down the area on your gum and the pocket depths are being reduced. This is the result and this is the goal actually. But in my mind and in studies and the treatment guidelines in Germany, it is quite clear that this flap surgery is just a surgery that is very rarely being made, all about due to these problems I mentioned. And so we are doing our concepts in many ways, in almost every way, without this flap surgery. Wünschen, did you hear anything about laser therapy on periodontitis or even a hyaluronic acid gel application?
I remember that I got these treatments, but I had never heard about them before. Could you talk about the benefits of these two treatments?
Oh, of course, thank you. The benefit of using like a packed photoactivated laser system therapy is in optimization of the reduction of the pocket depth all around your teeth and an improvement of eradication on bad bacteria. And along this, there's always a much more improved healing process that runs much faster than usual. So patients do not have to deal with problems after treatment, after the surgery, and the session only will resolve in some problems afterwards in very rare cases. We also apply hyaluronic acid gel into the pockets after the application of the photoactivated therapy. And when we put it into the deep gum pockets after scaling, it is an additional treatment actually to help the healing process. This results in fewer after effects as well and provides a chance for even new bone development in certain cases in this area. So it means the bone is not growing in height, but it's growing in the area to flatten the area, you know. The problem in many cases, and the thing for patients really who are developing real problems with the teeth when they are already having a periodontitis, is they have like clefts on your inside your bone, and these clefts are really areas where bad bacteria is feeling very, very well, and so the process starts running. And when we are able to do a treatment that flattens this area all around the teeth, so we get a more balanced bone alveolar level.
So it's like muddy road that if you even it doesn't have accumulate water afterwards after the rain, but if it has a lot of
well, there was actually a therapy in 30 years ago that had a flap surgery protocol that said when we open the area to have a closer look on the bone with flap surgery, we are trying to modify the bone level with certain methods to have a leveled system. So we even reduce the bone with this surgery by reducing the bone even more. And this did not really show a great number on success because we had another additional loss of bone. But it showed the way we learned about this disease, you know.
Mm-hmm. I think nowadays some dentists are trying to do Knochenaufbau after they do flap surgery, so they build it outwards instead of like in the past to go inward into the bones.
Yes, there are definitely methods that are being done. It is not that great successful though, but it is possible to improve the situations as we do with hyaluronic acid gel application.
Yeah, I definitely agree that they worked really well on me, and especially I got packed treatment on my wisdom tooth after extraction, and I had basically no swollen and no inflammatory reaction. So I recently just talked to a friend, and she told me her husband had 2 wisdom teeth extracted, and because he only went with the normal procedure and didn't get packed laser treatment, he currently has pretty bad swollen on both sides. And yeah, I think it was a really good recommendation from you, and I eventually took it, and it was really great. And as far as I remember, these 2 treatments are not covered by public health insurance. So do patients usually accept these treatments and pay privately?
In the most ways, patients really do accept after informing them very well. So it's no must. It's a chance for a better healing process. It's a chance for a better therapy. And we offer these methods when patients really suffer on pocket depths on like 5 millimeters and even more. So if it's just like 4 millimeters, we do not offer this therapy, because in my mind then it is just a good way to do the standard protocol, and the healing process will go on just like usual, and there's going to be no really chance for really bad side-on effects and so on.
Okay, so based on my own experience of being completely ignorant about periodontitis in the past, I imagine that you also see patients who know nothing or little about this disease, and you tell them that you have periodontitis, and they probably suspect, and they don't know what's going on, and they don't want to receive the treatment. So do you have some magic to make them accept the treatment?
Well, actually it is quite persuading for patients if you show them x-rays like this and to show them the real bone loss they already have, compared with their age. You know, when this is kind of bone loss for a patient who's already maybe 70 years old, it might be just normal and is no real problem then when you have no inflammation in this area. But when you are only 34 years of age, it is definitely a thing to talk about. And we are talking here, in your case, Wenxi, we've been talking about a bone loss of 2.5 millimeters, alveolar bone loss in this area. It might be just 2 millimeters, and we improved this area, we improved the pocket depth, and there are no bleeding pocket depths anymore. And so the success of this treatment has been developed.
So this is already like 70 years old.
This is
bone loss.
Well, as I said, if this would be the case on a patient who is 70 years of age, I would say this is very normal and this is okay. This needs no treatment from this point of perspective, you know?
Yeah, that's pretty shocking, because seeing the picture and getting the information of roughly like how old your bones inside your mouth look like is quite shocking and scary. So we've gone through diagnosis, we've gone through treatment, and can we cure periodontitis fully nowadays?
Well, periodontitis will always remain an issue in every patient who's been treated periodontitis. You always have to attend the doctor, the staff, and go to a tooth cleaning, professional tooth cleaning very regularly. at least 2 times per year, rather 3 or 4 times. The most important thing really is to have a healthy microbiome inside your mouth.
So this kind of control after the treatment should not be a concern for those patients who actually go to dentists regularly, right? Like, because they come all the time or regularly, then they will always be checked, and if there's any problem, that will be discovered. So for our viewers in Germany, like for people who probably want to have a new dentist or who don't have a dentist yet due to maybe clinic closing down or this kind of like moving to a different city, where do you suggest them to find a good dentist?
Well, I would recommend them to have a look on the Google ratings and maybe on Yamida. This is quite a good thing to have a closer look in Germany. And then I rather recommend them to have a view on their websites as well, and if these websites are doing well, and also on patient recommendations like from your neighbors and from your friends.
And for people living in Berlin and East Brandenburg, I can definitely recommend Dr. Schubert's clinic. He's very patient-oriented, and his team really take good care of you. They are very sensitive people. So back from advertisement, I still have one issue that I would like to get clarified, which I mentioned before, is that I hear a lot that people say, I don't need to treat periodontitis at all because I just need to wait for my teeth to fall and then I can get implants or I get dentures. What do you think about that?
The best therapy is definitely to keep your own teeth healthy, and even if it's too late, then implants show a great option, like titanium implants or zirconium implants. But first, please try to get the best treatment for your own teeth, and my recommendation is really to start in your childhood.
And don't forget that if you don't treat your periodontitis, it's not only about losing your teeth, it has other negative impacts on your overall health. It's not just about your teeth, it's about your whole body. So be very mindful about it. And so in order to maintain good oral hygiene, we have toothbrush, toothpaste, dental floss, and sometimes those brushes that you use between the teeth. Do you have other products that you would like to recommend people to use?
Well, as I said, sustaining a healthy microbiome is nowadays the most important thing. Please avoid products that are in liquid form or even mixed with antibiotics, because probiotics in those products are no longer viable and also ruins your own microbiome. So we really recommend you to use probiotics, maybe as add-ons before and afterwards your professional teeth cleaning sessions.
Thank you for the extra information. So I believe we are coming to an end of today's dialogue. Dr. Schubert, do you have anything else to add?
Therapy for periodontitis really never ends. You always have to attend your personal, your professional teeth cleaning stuff, and just take care of your teeth, and then everything should be fine.
Thank you for sharing your valuable insights with us. I would also like to express my gratitude to you again for devoting your extra time and effort into public dental education.
Oh, it was a real pleasure for me, Wenji, and I'm very much impressed on your personal encouragement on this topic. Thank you very much for being here.
It's my great pleasure as well, and I really appreciate your encouragement and support in making this happen. Having been a periodontitis patient myself, I can empathize with those who are still struggling with this disease. If you found this video helpful, please click like and subscribe buttons below and forward this video to people you care about. And if you have any questions or you have your own experiences to share with us, please leave them in the comments. Your engagement is crucial in spreading awareness. Thank you.
If there's a specific topic you want to learn more about, maybe from us, please let us know. Feel free to write in the comments below. So until next time, thank you very much for watching. Bye.